Medical Office Assistant Clinical. To be a clinical assistant, it's very simple. Visualize the medical office. When you walk in, the front desk is check-in reception. Once the medical record has moved on to the clinical assistant or the nurse's station, they are the ones who take your vital signs. This is the area that we're focusing on. Medical Office Assistant Clinical. You want to follow these steps. Call your patient to the clinical area. Quickly review the patient's information. You want to make sure you have the correct patient. You want to review the medical and family history, any allergies, medications, and so forth. Ask the patient why they are being seen today. This information goes on the SOAP note in the subjective section, and we have an example later. Make sure you write the complaint in the patient's own words. Do not lead the patient into making statements. Take the vital signs. This goes in the O on the SOAP note. The vital signs are blood pressure, temperature, pulse, respirations, and weight. Escort the patient to the exam room and notify the physician. If the physician orders any procedures, you want to escort the patient to the lab and perform those procedures. Lab procedures are covered in the Medical Office Laboratory Assistant Manual. EKGs are covered in the EKG Tech Manual. Please view the clinical videos for vital signs, phlebotomy, injections, urinalysis, other laboratory procedures. You want to retrieve the medical record from the designated area in your practice. The medical record will already have all of the information in it. You just want to make sure that you review the information to make sure it's complete. Review the patient's demographic information. Once again, name, address, phone number, insurance card information. This is the patient history sheet. Once again, you're just reviewing the information to make sure that it is correct. Make sure all new patients have signed the authorization for treatment form. Authorization for treatment is very important if you want to make sure that the physician gets paid. Review the information to ensure that the signatures are valid. Encounter form. Remember, it's attached to the front of the chart. The physician will indicate which procedures he's going to perform. Your job is to review those procedures, make sure they are performed, and document it. This is the SOAP note. Generally, it's a blank sheet of paper with lines on it with the letters S-O-A-P. The S stands for subjective, which also means chief complaint. When you ask the patient why are they being seen, you place their information there. O is for objective, and that's where you indicate the vital signs. After you've taken the vital signs, you put the medical record on the door, and the physician will begin the exam. In the O section as well, the physician will indicate the exam notes. A is for assessment. This is the diagnosis section. Diagnosis is singular, diagnoses is plural. The physician will indicate, even though this SOAP note doesn't have the actual letters S-O-A-P, the format is the same. S also means chief complaint. The chief complaint explains why the patient is being seen. In this document, Jane came in today with a complaint of chest pain and shortness of breath. She says she has had this for about 2 to 3 days now. The O begins with the vital signs, blood pressure, temperature, pulse, respirations, and weight. And then it has the physician's exam, H-E-E-N-T, head, ears, eyes, nose, and throat, and CVS, which means cardiovascular. A is assessment. Patient needs to have a chest x-ray and 12-lead EKG, so the physician does not have a diagnosis. And plan. The patient is to have the previous mentioned procedures and then follow up at our office for the results and further treatment. This is still considered a SOAP note. This is your medication list. You want to indicate the date of service, all the medications the patient is on, and the dosage. Once again, you want to make sure you have all of your equipment together. Your blood pressure cuff, stethoscope, thermometer, a watch or a wall clock with the second hand on it, your black ink pen, and the medical record. Please review the video for steps to taking vital signs.